Hello, my name is Angela Knudsen. I am a BSN student at Santa Fe College. I'm currently taking pharmacology. And today I'm going to present a very basic PowerPoint about garlic. And my audience is going to be my patients. Now, the patient population that I usually care for in my position as an RN at Jan's Rehab Hospital are usually people that are not very educated. So about a 5th grade reading level is primarily what a lot of my teaching is going to be geared to today. So that way everyone can understand the content of the slides, and if they had any further questions or wanted more of an explanation, I could delve into greater detail during the presentation if necessary. So let's get started. Is garlic a friend or foe of the heart? First of all, you might have heard some of the myths associated with garlic throughout the decades. For one, I think that we're all familiar with, especially being that it's close to Halloween, is hanging garlic outside to repel evil spirits, specifically things like vampires. One thing I learned when doing research is that the Romans were giving garlic to strengthen themselves before going into war. And lastly, the Tibetans even used garlic to help with medical conditions such as constipation and upset stomachs. So what are some other things you might have heard about garlic? Well, if you have been up late watching infomercials about some of the current products on the market, you might have heard that garlic can lower your triglycerides or cholesterol. You might have heard that it can lower your blood pressure. And you might even have heard that it could decrease the risk of blood clots. But are any of these claims true? How do you know? And is it safe to just start supplementing with garlic, even though you might already be on medications for any of these conditions without speaking with your healthcare providers? We are about to find out. So, when it comes to blood lipids or triglycerides, several studies have been completed. However, none of them were particularly good. In fact, in looking through the literature, many of these studies were not double-blind. What that means is that the participants that were either in the group that were actually getting the real drug versus the placebo, which means basically just like a fake substitute to use as a control, they could tell which group they were in. And with garlic, it's pretty obvious why many of the participants could taste the garlic in the supplements they were receiving. So compliance also is an issue. Many people didn't finish the studies that had agreed to participate, and they were small sample sizes. I saw some as few as like 25 people. And anytime you're testing a supplement, you need to have a large sample size and ideally a double-blind study in which neither the administrators or the participants know exactly what they're receiving, so that way they're not treated any differently and the results can be interpreted more objectively. So the results were also very varied. Just a few of the studies found that the garlic did decrease triglyceride levels, but most of the studies didn't see any change at all. The only caveat that I did find in the literature is that when fish oil was also taken along with garlic, there was a significant decrease in LDL as well as triglyceride levels. Now, I'm sure you probably heard the terms HDL and LDL thrown around. LDL stands for low density lipoproteins, and those are the bad cholesterol you want to get rid of. Whereas HDL stands for the high density, and an easy way to remember that is H is healthy. So the high density lipoproteins are good, the low density ones are bad. So that's something to consider. Maybe more research will be done in the future to talk about the benefits of fish oil and garlic. But that's another topic, so let's keep progressing with our discussion. Basically, the conclusion, because the results were so varied, the studies were poorly conducted, The only safe conclusion to really draw from them is that for now, garlic should not be used to treat mild to moderate hyperlipidemia, just because everything was so varied that it can't really be trusted. So our next topic is blood pressure. And unfortunately, we don't have a ton of studies here either, only 30, that specifically looked at the impact of garlic on blood pressure. And of these 30, only about 25% of them did find a significant reduction in the blood pressure of the participants, but these were also very small studies. Lastly, we're going to talk about garlic's role in blood clots. And you guessed it, just like the first two topics we discussed, the studies found very different results. And they were inconsistent. Some suggested that it helped, some suggested that it did not. And the other thing that the study took into consideration, or at least the results interpretation did, is that different formulations of garlic were used in these trials. And different formulations can have very different effects. So it was sort of like comparing apples and oranges. However, one very important thing I do want everyone to realize is the following quote, which I will read aloud. Garlic, often used to treat hypertension or to lower cholesterol, although such benefits have never been validated, may increase bleeding when taken with warfarin. Warfarin, you also might be more familiar with it as Coumadin, and when you take garlic and Coumadin together, your blood could become dangerously thin, putting you at risk, for a hemorrhage or something if you fell. So it's exceedingly important to not take garlic if you are taking Coumadin. And many of the patients here are taking Coumadin. Many have history of atrial fibrillation, and many others, just after their surgeries, aren't moving up and around as much as they would have normally. Thus, they are also at a higher risk for blood clots. So it's important that we do keep these patients anticoagulated, but it needs to be at a safe level, which is why we check those INR levels pretty much daily. But when you add garlic to the mix, it can definitely increase them dangerously high. So something to keep in mind. And basically now, just to review everything that we discussed, all the studies that we looked at today when it comes to either blood pressure, triglycerides, or blood thinners, they all have had very mixed reviews. And many of these studies have really not been especially well done. They were either very small sample sizes, they weren't double blind, the participants knew what drug they were taking, different formulations were used. So the bottom line is that more research really needs to be done before we can draw any definitive conclusions. One important point that we just reviewed, but I want to really make sure that this is clear, is that when you are on the drug Coumadin, taking garlic supplementation with it may make your blood dangerously thin, which can increase the risk of hemorrhage. So, lastly, I want everyone to know how important it is to share with the healthcare team and your providers exactly what other treatments you have taken or are considering taking in the future. For instance, if a patient didn't realize that taking garlic while on Coumadin could be dangerous, they might do it and not let their doctor or nurses or anyone know. And then, we would be helpless, to help. So our job is to give you holistic care. We understand that taking herbal supplements is becoming more and more common in the mainstream. We understand that many people have lost their health care insurance right now and their benefits, and they might be looking to turn to herbs to find a more economical way of managing certain conditions, and we understand and we respect that. But the only way that we can keep you safe is to know exactly what you plan to do, and then we will treat you accordingly and at least let you know what the risks are so that you can make informed decisions regarding your health care. So I hope everyone has enjoyed this presentation today. If you have any questions, please let me know. I'm happy to answer them. Thank you.